Welcome to This Explainer. Magic mushrooms are the new mental health frontier, but are we sprinting ahead of science?
We hear they're miracle cures, but honestly, do we even know what's actually inside these fungi?
Well, a landmark 2022 study reveals our foundational science is shockingly lagging behind all this clinical hype.
When treating severe trauma or depression, you'd expect absolute surgical precision from our medicines, right?
But the reality? It's kinda chaotic. Researchers often don't even know which exact mushroom species they're testing. Shockingly, 13% of museum specimens labeled as magic mushrooms are completely different non-psychoactive species. No way.
This wild identity crisis plagues fungaria. Those are the essential museum archives scientists rely on for baseline data.
Decades of strict drug laws and missing DNA records have basically left us flying completely blind here.
Plus, even if we get the species right, the actual therapeutic magic inside is quietly vanishing over time.
Modern freeze-drying preserves those active compounds, but traditional heat drying and long-term storage absolutely destroy them.
In fact, a 40-year-old specimen might have zero detectable traces of the very compounds scientists need to study. Curiously, bigger isn't better. Large, high biomass mushrooms actually lose their chemical potency way faster than smaller ones. But here's the real kicker. Psilocybin is just one tiny piece of this giant therapeutic puzzle. Get this, researchers just found over 1,400 totally uncharacterized chemical features inside cultivated magic mushrooms. We barely know what they are. Some act like synthetic antidepressants, while others are totally unexpected allergens. Fungi are also literal sponges. They absorb random chemicals from their soil, adding massive unpredictable variables to treatments. So, why does this massive scientific gap matter? Because actual human health is on the line. Prescribing whole mushrooms without knowing their exact makeup introduces severe regulatory nightmares and very real therapeutic risks. To fix this, scientists absolutely must standardize chemical testing and map authentic DNA from historical museum specimens. As we rush into the psychedelic renaissance, can we really build reliable medicine from a total mystery?